Hi, I'm Teresa Weezar, your host of 1 in 10. In today's episode, What the Pandemic Revealed About Exploited Youth, I speak with Dr. Matt Kafafian, Director of Graduate Studies and Assistant Professor of Sociology at George Washington University. Over the last few years, a series of studies has looked at the after effects of the pandemic. And it's examined many different areas: medical care, the mental health crisis in youth, the economy, and effects on criminal justice. But until now, no one had examined the way that the COVID-19 pandemic had shaped the nature of the exploitation of children and youth. How did the pandemic change the ways in which youth are commercially sexually exploited? And what does this mean for the identification of victims and the referral to services? And how might the nature of those services themselves change as well? America is still unpacking the effects of the pandemic on youth. And as you will hear, these most vulnerable ones are really no exception. I know you'll find this as thought-provoking a conversation as I did. Please take a listen. Hi, Matt. Welcome to 1 in 10.
It's great to be here. Thank you for having me, Teresa.
So I'd like to kind of start at the beginning. I'm curious about what made you think about looking at what has changed between pre and post-pandemic related to CSEC and the kinds of cases that are getting referred?
There's a few different kind of streams of ongoing research within criminology, but then also ongoing trends we saw with reports by the FBI and nonprofits that kind of impacted our perceptions of these changes. Also conversations with practitioners we work with, like changes, at least anecdotally, in the types of cases that they were seeing as they were being referred. And on one hand, we saw a lot of research in criminology talking about the changes in routines because of the pandemic with law enforcement and other kind of institution tasked with identifying victimization, right? Everyone was locked up in their houses and apartments, and it was more difficult for formal institutions to come in contact with victims. And so we presumed that these changes in routines, based off of other research on different types of experiences, might change the type of victims that are being identified. Relatedly, we saw reports from NCMEC and the FBI reporting on kind of large increases in hotlines and referrals for youth identified for concerns of online exploitation. And when we think about commercial sexual exploitation, right, it's a unique victimization experience because it happens in both public and private settings. And we see the pandemic impact these public settings, right? And so we've made assumptions that the COVID pandemic might impact the private settings in which this victimization experience might manifest. And relatedly, we just heard from the practitioners we talked to and work with that they were seeing a lot more referrals for youth with online concerns. And so that's how this paper came to fruition.
Well, it's really interesting because there were so many different, I guess you would say, considerations with this. As you're saying, there was the external environment, and yes, police were tasked with doing different things. You had CPS, who for long periods of time weren't doing in-person visits. You had hospitals that were overwhelmed with COVID cases, so their attention in the ER wasn't necessarily around doing screening for CSEC or other things, and even within children's advocacy centers. And let me just name for everyone who hasn't yet read the paper that this was done in partnership actually with a children's advocacy center. But their own caseloads and how cases came in, how many cases they could see at a time, like all of that changed. So it's interesting because now looking back, I feel like that time was a little bit of a blur. So reading your paper in many ways brought that back to me about just how different that period of time was. And it's good to see what might have changed during all of that. Just to level set for people who may not be as conversant as you are in the literature, let's talk a little bit about pre-pandemic for a minute.
Yeah.
And what was known pre-pandemic about the sort of specific vulnerabilities that youth have at the individual and family level that might bring them to the attention of authorities or be a part of a referral or those kinds of things. Because we're really talking not about kids who pop their head up and go, I'm being exploited, but rather they came in contact with authorities in some way. And that's how they came to our attention.
Yeah, for sure. A lot of research prior to the pandemic, we're making a lot of headway and better understanding, as you said, the individual characteristics, the family characteristics that contribute to risk and vulnerability for minor sex trafficking. And a lot of research documents the role of historical adversities, right? Experiencing abuse, whether that's physical or sexual, being exposed to issues within the home, right? Parental substance misuse, family separation, substance use participation by youth. And all of these kind of situations are seen as kind of risk factors that propel youth into circumstances that are risky, that put them in situations of exploitation, right? And some of our previous research found that we find these kind of social kind of settings, or what we call proximal risks, amplify or are predictive of youth being likely to be exploited. And so this is traveling out of state without caregivers' consent, right? Spending time with other youth who might be engaged in commercial sex, being approached to engage in commercial sex, right? And so we find kind of these historical adversities, these family issues propel youth to be in these risky situations that put them at risk of being exploited. And a lot of kind of these social settings in which youth are likely to be exploited obviously changed dramatically during the COVID pandemic.
Well, and things like running away or being
Yes.
thrown away, for that matter, homelessness in general, things like
Yeah.
that. And one of the things that I was thinking about as I was reading the paper is I think over time, a lot of work was put into training people to identify these situations that were potentially risky for kids to be trafficked, and really assessing kids, whether they're coming into a CAC or coming in contact with the FBI or anybody else, that were based on these risk factors we're talking about. All right, now cue the pandemic. And lots really changes. So I want you to talk to me for a minute about what were the unique stressors or changes to the environment during the pandemic that really just meant that we were going to be, if we kept looking at those things, looking in the wrong places to some degree.
Everything moved online, obviously, and youth were just continually online without kind of oversight. We know that youth run away because they're experiencing some sort of abuse or adverse experience. But during the pandemic, there's the potential, and research highlighted or flagged this kind of concern that youth might be experiencing some of these things at a higher degree because they're in home all the time. They're not being identified by teachers or other service providers like medical doctors that they're coming in contact with. And we know that the COVID pandemic might have exacerbated some of these risks and vulnerabilities we already talked about, but also at the same time, they're stuck within those situations.
I was just thinking back to the pandemic and my own experience of it, which I think that many people found themselves online more because their opportunities for community, aside from an online environment, were just smaller. And so you can just imagine these kids at a time in their life when peers are so critically important, right? When you're a teenager and then you're cut off from them in person. It's not like you're going to their house, hanging out at school, all the things that they do. So what are you spending your time on? And sadly, offenders take advantage of that and looked, I think, in this environment for that. So let's then now move to your study itself. So talk to me a little bit about what your hypotheses were going into the study. What is it that you fundamentally were hoping to learn? And then we'll talk about what your findings actually were.
As we talked about, there was a lot of headway on research, understanding kind of risk and vulnerability that contributes to the likelihood of exploitation. And so primarily we're interested in, as the pandemic reshaped the type of youth being referred, because the changes brought on by the pandemic, but also the continued changes that we see today. More people are online more, people work remote more, we're on Zoom, youth are online. And so we were very much interested in, does their knowledge from before the pandemic extend to the current circumstances and social environment that have inevitably changed because of the pandemic? And so our hypothesis was probably, particularly because we were seeing these reports of increased concerns or referrals or hotline calls related to online exploitation of children. Talking to practitioners we work with, they were seeing this kind of anecdotally. And so we're very much interested in understanding, can we statistically see these trends in our data that we're hearing about from NCMEC, the FBI, but then also the practitioners we work with.
One of the things you pointed out in your paper, and I thought it was really interesting, is that it's not only just being online, but even the nature of some of the forms of exploitation that sort of cropped up over the last few years were somewhat different. I think people had an idea in their mind about what CSEC was pre-pandemic, and then you saw this rise of things like sextortion or these online groups that were encouraging and blackmailing children to harm themselves or pets or others. And I think that it just felt qualitatively different, even.
Yes.
Tell me a little bit about what your study found in looking at these questions about change, not change, and whether or not something surprised you in your findings.
We explored statistically, there were differences in kind of the profiles of youth being referred for concerns of commercial sexual exploitation to a specific child advocacy center in the Northeast. And what we found was there were two primary kind of profiles of interest. One of these profiles of youth being referred were youth that have long lists of adversities and all these risk factors that we know contribute to the likelihood of exploitation and having a high probability of being confirmed exploited. And so we found that this was one of the primary kind of profiles of youth in our entire data. And then we also found a profile of youth related to concerns of online exploitation and not having any of these historical adversities or other risk factors that we know are important in contributing to risks for CSEC. These profiles were more likely to be identified before the pandemic and after the pandemic. And so what we found was that profile related to youth with a long list of adversities and kind of the risk factors we know contribute to the likelihood of being exploited and having a high probability of being confirmed exploited were statistically more likely to be referred prior to the pandemic. And we found that the profile of youth who were referred for online concerns but don't possess any of those risk factors that we know are important in contributing to risk for CSEC were significantly more likely to be identified during the pandemic. And when we ran our analyses, that first group where they have high probability of being exploited and having all of those historical risk factors and adversities that contribute to risk didn't exist in the data after COVID statistically. And that profile related to online concerns didn't exist in the data before. And so what it's telling us is that the type of youth being referred since the onset of the pandemic have just changed dramatically statistically and qualitatively.
I'm curious, when you think about what you just said, we're really talking about referrals. So I'm curious how you think about whether or not the baseline population, the total population, it's essentially fundamentally has changed, or if it's what's coming into the CAC that's changed pre and post pandemic.
Yeah, I think that's a really interesting question. And we talk about it in our discussion. We don't really quite have an answer. As we're seeing a lot before the pandemic, we saw about 25% of the sample being indicated as being confirmed exploited. Since the pandemic, only 7%. And so the question is, are the type of youth being identified, have they changed? And if so, is it because the changes in routines of different agencies that are tasked with identifying and making these referrals for concerns, things are still more online, so that has that just changed? Or has the proliferation of kind of just online exploitation become front of mind of practitioners? And so the concerns related to that are more likely to be identified and referred compared to previous concerns related to more traditional or offline exploitation. So it's hard to know whether the population of youth being referred has changed because of changes in routine or just youth are possessing different risks and vulnerabilities and experiences, and those have just changed since COVID because of, again, the changes in routine. So it's hard to know whether it's like referral mechanisms and the type of youth likely to be identified, or has the population of youth at risk for CSEC just changed?
That is all a very interesting question. I'll tell you one thing that makes it even more interesting to me. If you track the period that you were looking at, which was what, like 2015 to 2022? Can't remember. Yeah. Something like that. Okay. So for children's advocacy centers, within that same band of time to the present, so it's not a one-to-one overlap, but for the last, if you say 7 to 8 years, within that period of time, nearly 700 children's advocacy centers have signed on to our MOU with the FBI to serve CSEC cases, their CSEC cases specifically. And it does make me wonder, because so much of their attention has been focused on online exploitation, naturally, and so many of the cases that they're bringing in relate to that. It does make me wonder if that has shifted attention somewhat, because we're simply getting a caseload we weren't previously getting for most of the communities that are now getting those cases. So It's interesting. And also, there's more training. The FBI have been wonderful partners in training children's advocacy center staff on many of these things and on interviewing these kids and so many other things and training MDTs. So there's a part of me that wonders if this is, you just looked at one CAC, but it makes me wonder if just overall, naturally, as people learn new information and these kinds of things, it shifts their focus a little bit. And so we're not going to know the answer from this study, but it does make me wonder if it has been shaped to some degree by some of that. And of course, there's all the training law enforcement goes to that has nothing to do necessarily with something offered by the CAC, but also it's gotten a lot of attention, especially around abusive images, extortion,
Yeah.
generated images, like all the different variants that have been very much in the news over the last 7 or 8 years too.
Yeah. And I think another challenge related to our findings related to all of this is we're unable to confirm the nature of these kind of concerns related to online exploitation. We find that most of these youth identified for online concerns aren't actually confirmed exploited based off our indicators. So these indicators related to being found in an online ad, participating in survival sex, third-party disclosure that the youth is being exploited, or first-party disclosure. And so one of the challenges with our findings is that we're unable to confirm whether these referrals meet the threshold of being confirmed exploited, which is really challenging. And so that's another kind of wrinkle in our findings, right? We're seeing a large proportion of these referrals being online concerns, right? But we're not able to verify whether or not these youth are confirmed exploited compared to the previous type of youth we were identifying before the pandemic.
One of the things I was thinking about as you were talking is that, for one thing, you've chosen a particularly challenging group of kids to study, and that we know that they are notoriously reluctant to disclose things like they've been the subject of abusive images, or because so many threats go along with extortion. That's another one. So you've chosen a subject that I think is so critically important and very interesting, but where I think youth are less likely to go, oh, yes, that happened to me. And so that makes it more challenging. So one of the things you included in your paper was a very interesting chart that was just like post-pandemic. And it had a lot of demographic information and other breakouts. I'm curious if any of that really stood out in your mind as, wow, that is such a shift in terms of what we saw pre-pandemic versus what we're seeing post-pandemic. In other words, even looking at all of these youth and knowing your overall findings, was there anything more granular where you're like, wow, this is a really interesting shift in who we're seeing referred?
Yeah, for sure. One thing we're seeing descriptively in our data is that there's been an increase in proportion of males being identified for concerns of exploitation. And when you read the reports by NCMEC and FBI, they report on a large proportion of these referrals being related to males. And historically, most of the youth, at least identified in our data, are female. And so when we ran our analyses, we controlled for gender. And one thing that was surprising for me, at least, was that gender was not statistically significantly associated with kind of these new types of referrals that we're seeing. And so it's more of a highlighting of a null finding, just based off of, again, anecdotal. Descriptively, we're seeing more youth being referred who are males, at least with the CAC we work with and the data that we have. And we're seeing it through FBI reports and NCMEC. And so that was like one finding I expected, but we didn't find, right? And so I think at least future researchers continue to parse out the role of gender in kind of exploitation, particularly with these kind of anecdotal reports we're seeing from other kind of data sources related to gender and risk for online exploitation.
So one of the categories too that I thought was really interesting, one of your findings really related to an emerging profile post-pandemic that also had these unique aspects of mental health concerns. Yes. And I talked a little bit about that because I was like, well, that is just really interesting, because I do think that's not something that we've seen in the literature much up until now.
Yeah, no, that's a really great question. Yeah, so in our kind of profile related to online exploitation that was more likely to be identified since the onset of COVID, we found that those youth had a high probability of experiencing historical mental health concerns and mental health concerns at time of referral. And there's been some research that has found that mental health is potentially associated with risk for vulnerability, but it's often tied to the other historical adversities that they experience. And so what was interesting about this profile was that they had a low probability of possessing or experiencing kind of these adverse experiences. When we talk to practitioners we work with about interpreting this result, I don't know if we came to a good conclusion on what was necessarily happening. Our kind of, or at least my speculation, is that it could be just like mental health concerns that are maybe exacerbated because of the online experience that they're being referred for, right? And so these two things are happening in tandem. We also know that kind of emotional vulnerability can lead to risk for exploitation, right? And as you highlighted earlier, youth were online more because of the pandemic, but they're also online more because of social interaction and the need to want to interact with other people. And so it could also be the case, and again, pure speculation, we just controlled for whether or not they had mental health concerns. And so speculating on the potential mechanisms, it could just be also the case that these youth were in maybe a potential emotional vulnerable circumstances, and therefore they participated in maybe online kind of behavior that put them at risk of being taken advantage of because of those emotional circumstances. And again, pure speculation. So it could be the negative mental health could be because of experiencing kind of the acute strain of the online exploitation, or it could be that was a potential pathway to being exploited potentially online.
I think it's a really interesting point because, of course, coming out of the pandemic, I think there's been a lot of media coverage and the Surgeon General's report and everything else on the mental health of youth through and post-pandemic, and the mental health crisis on the part of youth based on that experience. And I think that it's an interesting interaction, right? Like, it certainly didn't help their mental health to be exploited. And at the same time, the fact that they might have been anxious or depressed or isolated or whatever also may have contributed to their vulnerability for exploitation. And if I'm remembering right, it also, in your study, this particular profile also related to exchanging sexually explicit media online. Is that right? And do you think that's really just, honestly, teens don't have the brain development that adults do. So some of it is just like bad judgment because they're teens.
Yeah.
But I'm just curious about what you make of that.
This was related to what I highlighted before. Our kind of proxy for being referred for online exploitation concerns is sharing sexually explicit images. And one of the challenges of this measure is that we don't have enough information to know about the nature of these online image exchanges. And so it's hard to know whether these exchanges were consensual between kind of peers within their friend network, and they're being referred because, according to the JVTA and our definitions of exploitation, child pornography falls under it, right? Or are these online image exchanges more kind of malicious in nature, right? And it's really hard to know based off of the data that we have, right? All we know is that these online image exchanges likely triggered why they were being referred to the Child Advocacy Center for concerns related to commercial sexual exploitation.
So when you think about your findings as a whole, and it's always this way with research that it opens up as many new questions as it answers, right? But I'm curious about what you think the implications are for child abuse professionals, because that's really your audience for the podcast. And why they're listening, they're like, so what does this mean for me in terms of what I should be paying attention to, in terms of how I think about kids who are particularly vulnerable, in terms of the prevention efforts that they have underway, whatever part of that you feel like there are implications to talk about and share.
Yeah, for sure. The big finding is that these youth referred for online concerns, right, don't possess most of, if not all of, kind of the historical adversities that make up all these screening instruments that we have to help identify youth who are at risk or confirmed to be exploited. And the question is, are these youth being referred for online exploitation? Can we confirm they meet the definition of trafficking? And if that's the case, our kind of current screening instruments that we spent so much time developing and validating over the last 10, 15 years, it might be the case that these risk factors and vulnerabilities that make up these screening instruments might not be useful or helpful in identifying these youth who are at risk for online exploitation, right? And so that means that we need to make sure that youth aren't falling through the cracks in the system if they don't meet these characteristics that make up the screening instrument. And so the policy implications are, is that the screening instruments might not be effective for identifying these youth at risk for online concerns. I think the other kind of implication more for research is we need to find out what are the factors that contribute to the risk for youth being identified for online concerns. And so I think the big kind of policy implication is like our current state of screening instruments and whether they're effective for the type of cases that we're seeing more and more, right? I think so that for me, the kind of the big policy implication is our screening instruments because they're the first line of defense used by social workers, child welfare providers, medical providers, and schools, right? And so if those don't possess kind of the risks and vulnerabilities we know are important to predict this type of exploitation, we need to reevaluate and come up with a tool that does.
So what is next for you research-wise on this topic or another? Is this something you're digging into further, or have you moved? I know you guys have papers going on all kinds of subjects all the time, but what's next?
Yeah, for sure. We recently published a paper that was led by a colleague, Ika DeVries, where we explored the role of social networks and kind of social exposure to that increases risk for exploitation. And we find that social exposure or social networks is the most kind of salient factor that contributes to risk. And so we've done that. More future research. I'm currently working on a paper where we dig into this paper more specifically. And so as I highlighted, we're exploring whether those kind of traditional risk factors that we know are important that we found before COVID, do they help us understand the likelihood of youth being identified for these online concerns? And to further confirm our suspicions as whether or not our existing research kind of translates to this different phenomenon. So I'm working on that. I'm also working on research related to understanding differences in risk based off of gender. And so if you look at a lot of the existing research, it uses child welfare data related to commercial sexual exploitation, which is predominantly females who are being referred. And so I'm very much interested in understanding whether our existing knowledge on risk and vulnerability to trafficking, all of those things we talked about that we found before the pandemic, do those also help us predict the likelihood of whether or not male youth are likely to be exploited? And our preliminary findings suggest that probably not, and that there are likely differences in risk, which also have important implications for kind of the screening and identification of male victims of trafficking. And those two kind of papers in particular are what I'm exploring right now.
We look forward to hearing more about the follow-up study and how interesting in terms of the effect of gender, because it's true that because most victims that were identified in the past were female, of course, the screening tools and the standardization of those and the validation of those tools was really all done using a heavily female population. So it's an interesting question you're asking about whether it's an entirely different thing when you're looking at male victims that you're seeing crop up more with online exploitation. So interesting. Feel free to come back at any time and talk about those when they've been published as well. But I'm wondering, is there anything else that I should have asked you and didn't, or anything else that you wanted to make sure that we talked about today?
Yeah, for sure. I wanted to first highlight my co-authors on this paper, right? Ika DeVries and Amy Farrell. They're both kind of mentors of mine. We also all worked together to develop this database when I was in grad school. And this paper is a collaborative kind of paper. While I was first author, they had heavy hands in helping shape this paper. So I want to thank them and highlight their participation in this. And also co-authors Sheila Gobar and Beth Bouchard, who have been co-authors on these papers. And then also importantly, the practitioners I work with, right? The people who we work with to develop this data and who we read these papers and give us feedback before we publish these papers, right? To make sure that our interpretations of the results are situated within people who work in the field. So I want to thank all of them for kind of the years of collaboration and kind of getting to this point. And so just want to make sure I shout them out and thank them for that. But otherwise, I just want to say I really much appreciate the opportunity to share my research on a platform that will reach practitioners, because that's always the goal for us academics, right? We don't want to just write papers and they kind of get lost in the ether within the ivory tower, but actually our results be shared with practitioners that kind of help inform policy and practice. So I appreciate you giving me the opportunity to do that.
Well, Matt, thank you for coming on to 1 in 10 to talk about it. We appreciate that it takes a village to get these papers done and published, and feel free to come back anytime.
Awesome. Sounds great. Thank you so much.
Thanks for listening to 1 in 10. If you like this episode, please share it with a friend or colleague. And for more information about this episode or any of our other ones, please visit our podcast website at oneintenpodcast.org.